My name is Josh Barnett, and I'm a home health occupational therapist. Being a home health occupational therapist, it kind of looks different every day. I go into homes, evaluate, treat, and assess patients and see kind of where they're at and goals that they have. We look at in occupational therapy just their ability to take care of themselves and do everything that they were doing before. So whether that's getting out of the bathroom, dressing themselves, doing stuff in the kitchen, doing laundry, we want to get them back to their prior level. So success in this role, I think the first thing that has to happen is building rapport with patients. And then from that point, success looks like meeting their goals. We have to be creative in the home. So you're not in a clinic where there's machines or equipment. You bring in a bag and you may have TheraBand, you may have other small things that you can fit in a bag, but you're not bringing an elliptical in. You're not bringing a new step in. So you have to be really creative, but that's also it's very functional. So we look at functions. Creativity looks different. One time around the Christmas time, we had a patient that had Parkinson's and had balance issues, but she loved Christmas, and she hadn't been able to put her Christmas tree up. There was a box of ornaments, and there was a tree. So we can work on reaching down, her core strength and her balance and base of support, and then also reaching, using her upper extremities and reaching. That can simulate reaching for stuff in the kitchen or reaching for things in the bathroom, but it's also a meaningful activity for her. So in a clinic setting, you're not working on, you may be able to do something like that, but you're not using her ornaments or her tree that she values. In another setting, if I have a busy week, I'm paid the same. If I have a busy week in this pay-per-visit model, I'm making much more and I'm able to provide a lot more care and I'm rewarded for that. Visits can look different, but they do often, you're able to spend more time with the patient. It's not minutes based, it's based on just the visit. So as long as that patient needs, and we obviously have to see lots of patients in the day, so we can't spend all day at one patient, but as long as that patient needs, there's been times where I spend rarely, but I've spent over an hour with the patient because there's lots of needs in the home. Autonomy is huge. So when I'm actually describing this job to my therapy friends, autonomy is one of the first things that I go to. Is I'm on my own. I'm kind of on an island, I guess. Collaboration is so important because we're in the home on our own, but we all have to provide our own unique types of skills to provide for that patient, to provide the best patient care that we can for those patients, for the caregivers, and for everyone in the home. One of the first things that we need to ask is, what is your goal? Because if we want to go in there and assume what the goals are, that's not fair for the patient. It's, hey, how can we work together and get you back to where you want to be?